Welcome to Ponchatoula Live, the show where we make it easy for you to connect with the people of Ponchatoula. I'm your host, Parker Layrisson, and today I've got a fantastic guest. This is one of the most beloved men in Ponchatoula. He's deeply respected. He's been a top professional in our town for many decades. And one of the things I admire about Dr. Greg Allen is he's not only incredibly accomplished, but he's got a giver's heart. He and his wife and his family give so much to our local community, and as you'll learn, even to the international community through his efforts. So, with no further ado, I bring Dr. Gregory Allen. Dr. Allen, welcome to the show.
Oh, thank you for having me. Good afternoon.
Well, thank you for coming on. I know your time is very valuable, and so we'll get right into it. Why don't we kick things off with you telling us a little bit about yourself?
Well, I'm a Ponchatoula High School graduate in 1975. My dad and I, the kids, we all moved back here when I was about 11 years old. We've been here since then. And married to Kathy Allen, been married for approximately 45 years, have three children, Lauren, Caroline, and Brett. Lauren's a nurse practitioner. Caroline lives in Wyoming, and Brett does industrial engineering. And we have six beautiful grandchildren, five girls, and one little boy. And that's my joy right there.
You seem to light up when you talk about your grandkids. I've noticed that whether we're at church or wherever, you clearly have a passion for medicine, but you have a zest for your grandkids that exceeds even your professional interests. Let's talk about family. So the Allen family, of course, is one of these old school Ponchatoula families that's been here forever and frankly been prominent forever in business and medicine and education, you name it. Your Uncle Virgil, who's been on the show, was my principal. I was in his last graduating class at Ponchatoula High School. My classmate was your cousin David, another Dr. Allen. And so you guys have been around for a while. And of course, your father was a very prominent doctor here in town who preceded you as, say, Ponchatoula High School football team physician and such. So if you don't mind, Dr. Allen, tell us what it was like growing up in your household. And you mentioned moving away, moving back. What was that experience like for you as an Allen kid?
Well, growing up, I was basically born in Baton Rouge, and my dad was a pharmacist. People don't realize that my dad is actually a pharmacist before he became a physician. And when he was a young man, he decided he had a heart for medicine. He decided he wanted to go back to medical school to be a doctor, and he got accepted to school in Mexico, believe it or not. So my father moved to Mexico for a time to learn Spanish. And finally, he got accepted here at LSU, and he came back, and we ended up relocating from Baton Rouge to New Orleans while he went to medical school. So I lived a portion of my time in New Orleans. And then my dad went to medical school in New Orleans, and he got accepted to residency to, believe it or not, OBGYN. And he was doing it.
I'm learning so many things about Dr. Allen I never knew.
He got accepted. He was doing OB. He did his internship of OB. And then during the Vietnam War, he got drafted into the military. And so he had to leave his military, his OB residency, and we transferred to DeRidder, Louisiana. So we lived in DeRidder for approximately 5 years while my dad was stationed at Fort Polk as a mass unit general surgeon. And then my dad, when he finished his service in the military, he told my mother he wanted to go back and complete his OBGYN residency. So he got accepted to a school in Arizona, a training there. My mother said, "Oh, absolutely not. We're going back home." So my mother was instrumental in my dad coming back here to open a family medicine practice in '68.
Wow. So without that strong-willed woman, there may be no more, your line of Dr. Allen's back here in hometown Ponchatoula. Y'all may have stayed out west or gone wherever.
It could have been totally different, but I'm glad he made that decision, came back home.
So we all are, because you have left a legacy as he did before you, and as Lauren's doing now and with her clinic, for healthcare here in Ponchatoula. I want to share, if you don't mind, Doctor, before we get further into your story, we've got a comment here from Marshall Graves. Hey, Marshall. Marshall, like you, Doctor, has been a guest on the show. And he says he joined the show and heard the word grandkids. And so he can see why there's a big smile on your face. He says grandkids are the best. I don't know, Doctor, if you got a chance to watch the big sports news in Ponchatoula this week. is that Marshall's son Allen, who plays for the Santa Clara Broncos, made it all the way to the conference championship against Gonzaga. And that
Oh,
game was
wow.
a couple nights ago. And after they upset St. Mary's, who's this other great team out west, sadly they lost to Gonzaga in that championship. But I love the grandkids photo. You know, Marshall had his grandkid, one of his grandsons, on his shoulders, and that
Yeah.
made it on the ESPN and TV. And then there was another pic of him holding up signs of his kids. So it's cool to see kind of one prominent local dad, watching another local dad and grandfather, and y'all comparing notes. So Marshall, thanks for tuning in. To anyone else who's watching live, as you noticed, Marshall was able to comment live, communicate with Dr. Allen. If you've got something you want to say to Dr. Allen, ask Dr. Allen, whatever, just feel free to click in the comments below, and I'll do my best to try to connect you. But Doctor, thank you for your patience with that aside. And I want to say, Marshall, shout out to Alan Graves. During this same week, his son made all conference. He was the freshman conference of the year, the freshman sixth player of the year. It's kind of funny, although he's the sixth man on his team, he was first team all conference, which is a head scratcher. But he's also a finalist to be the #1 freshman in the whole country. They haven't selected the winner of that yet. So big week for the Graves family. But certainly,
I remember them. Actually, I used to see them at the rec park walking those kids when they were little bitty fellas.
oh, really?
Him and his daughter, his wife, and he were out there walking
Yeah.
at Pard. I would see them all the time. So I was just amazed to see this child grow up to be such an athlete.
Absolutely. It's such a great family. Marshall's a dear friend of mine, and all three of their children have been Division I athletes. Their oldest, Marshall, played at LSU on an SEC championship team. The daughter you mentioned, Amara, played for 3 seasons at Auburn, and then now Allen's got a very real shot at making it into the NBA this year. So that's a really neat. The National Basketball Association is a tougher professional sports league to get in than anything. It's far tougher to do that than make the NFL or the major leagues, or because there's only 5 players on the court at a time, right? But let's get back to you, Dr. Allen, and your upbringing. So you mentioned, kind of this, and it's varied and sensational career of Dr. Merlin Allen, where both, chance on one hand and military service on another and family commitments on another, all these things, this confluence comes together to kind of, shape his career and his specialty and whatnot. You're seeing it from the vantage point as a kid. When do you decide you want to be a doctor like Dad? I mean, how does that come to light?
Oh, goodness. I really looked up to my dad, admired what he did, and saw the sacrifice he made. But I was kind of like, when I was a kid growing up and moved back here, my name's Greg. So when I moved back here and made friends with people here in Ponchatoula, all of a sudden I went from Greg to Doc. So I'm a kid growing up, going to school, and everybody's calling me Doc. I said, I guess I don't have to be a doctor. I don't know. But I just had a passion for it. I watched my dad. I watched the sacrifice he made and how much he enjoyed it. My dad loved medicine. He loved people. And he was such a giver. His whole life he was such a giver. And I just admired that so much. And so I felt a calling to follow his footsteps. It wasn't easy. It was so tough. My God, it was tough. But my dad was always.
And I bet there's an extra element of pressure when your dad's already done that and succeeded there, because it's just, you don't want to fail at something that Dad's done, and maybe there's an extra pressure not to let him down, at least implicit, whether he felt that way or not.
Right.
What are some lessons you learned from him before you became a doctor that would serve you well later when you did become a physician?
I say perseverance and never give up, never quit. My dad told me there's gonna be rocky roads. There'll be days that'll be tough. There'll be days where you begin to question whether I'm doing the right thing. Should I just quit, turn, and go to another direction? My dad always inspired me to persevere, despite any challenges you may go through. I'll tell you a story. I was in my first year. Actually, I was applying to medical school. I applied the first year, didn't even get an interview. Applied the second year, got an interview, got waitlisted. And I told my dad, I don't know if this is for me. He said, son, if it's really what you want, it's your desire, it's your passion, your goal. He says, keep pushing, keep pushing. And I finally got accepted into medical school. I get in my first year of medical school. I'm rooming with a couple guys who are upperclassmen. they give me all bad guidance, all bad information. I'm worried I'm gonna flunk out of medical school because my first test I took in medical school, I scored a horrible score on it. There was only 2 exams this whole class you could take, so I couldn't
Yeah.
break 100 past the class.
Oh,
I
wow.
called up my dad. I said, Dad, I said, I don't know if this is for me. I think I need to drop out. He said, son, let me tell you what you need to do. When you hang up the phone, I want you to get on your knees. I want you to pray to God and tell him to give you the endurance, the perseverance, the wisdom, the knowledge, and the guidance you need to make it through this. And that's what I did. And going
Wow.
forward, after that, it was nothing. It was not that difficult.
Yeah.
But just to be able to focus my faith, my religion, my relationship with Christ, and the knowledge my dad had and the inspiration giving me that push to go forward and to go for it. So,
well, what a blessing to have a father who's not only a fantastic dad to invest in you, his time, his energy, his attention, and more, but also to have that man be a respected physician who blazed his own trail, as you kind of described earlier. But and then finally to have that rooting, it's more important than the first two put together, in a Christian faith, to really know what's important and to know, who can really do this for you or not, right? Because with God behind you, you can't help but succeed in becoming a doctor. With Christ against you, you could never do it, no matter how hard you tried. What a blessing to have all of that in one spot in your dad. While we're on this topic of family, let's circle back to your mom, because I got the impression that she was a formidable woman. If she got your father back to Ponchatoula, Louisiana, and to kind of shift gears on different medical dreams, what did you learn from her, and what was she like growing up?
I'll tell you, my mother, if anybody had an impact from a spiritual growth for us as children, was my mother. She made sure that every Sunday we were in church. She made sure every Wednesday we were in youth group. And people don't know this, but my mom, never really had a college education. When she finished high school, she and my dad got married not that long thereafter. As a 40-some-year-old woman, she went back to school and got her bachelor's degree in nursing as a registered nurse, and worked in ICU after that, and then subsequently retired. At 92 years of age, she's still with us.
Wow, what a
But
blessing.
she would say the backbone of the family, held everything together.
Mhm.
And she was a disciplinarian, believe it or not so much my dad, but my mother was a disciplinarian. But she
Yeah.
kept us on the right track. She really did. She's a wonderful woman. And when we go through difficult times, we don't have dad around anymore. We go and sit down with mom, because she has such a knowledge and such a wisdom with
Yeah.
her. So, well, my
Wow.
mother is actually a Starkey by maiden.
Okay.
And so her family was from like the Tallman area.
Uh-huh.
And then she
Okay.
grew up and lived in New Orleans, and her and my dad met on a bus while he was going to school at Loyola to be a pharmacist.
Oh, small. Wow, small world. Well, I'm noticing a lot of similarities in the way you described your mom and my mom. My mother also went back to school to finish her college degree in her 40s. And I remember well us sitting around the same kitchen table, Bree, Louie, mom, and me, doing homework at the same time. In fact, it was your sister-in-law, Dr. Allen, or the math teacher who helped my mom get through calculus, which was the big boogeyman going back after all those years. And I really developed a lot of respect for her to be doing that while making pot roasts and getting us to ball games and doing, washing clothes and doing all the things a great mom does. And like you said, my mom was the disciplinarian too. So it's neat when you can have two great parents like that. I want to pull up another comment here. Lester Leroy Satoon, another great widely respected man of Ponchatoula. He says, Doc, that you are a good man from a great family. How does it make you feel to have somebody as prominent? The Satoons are another kind of great family of Ponchatoula. To have him chime in like that, what's that make you feel like?
Oh, it makes you feel great. Lester's a great guy. I love Lester. He's a wonderful man. I love him riding around town in his Jeep blowing his horn.
I know it. I love the Jeep. He's so cool and great guys. There's so many great Satoon guys running around town because of him, and it's really neat. Well, let's keep going here with kind of your life story. So you talk about getting into medicine, early stumbles, maybe some bad advice from upperclassmen, but then you find a rooting in your faith through the encouragement of your father. All the things you learned from mom and dad growing up. when did it start to click? And when did you realize, hey, I've got this, I'm good at this, I'm going to be a hell of a doctor? And kind of what was that path like from early med student to young physician?
I think really about my second year of medical school where it really started to click.
Hmm.
I married my girlfriend from high school, Kathy Lockhart. And I think at that point, being married and being settled and being able to focus on academics in school really kind of helped me get that direction. And then once you started your clinical years, your junior year of medical school, working in Charity Hospital, and through that entire endeavor, meeting other residents and other students just like you, people like Pat Delaney, who was actually one of my residents, believe it or
Oh
not,
yeah, Dr. Delaney.
cardiologist. So
Yeah.
getting that mentorship and teaching us what we need to know, being young
Mhm.
doctors coming up, and just that whole challenge. So
Yeah.
I think that's probably about when.
Thanks for giving a shout out to Dr. Delaney. He's not only, a respected doctor, but a great guy. He and my dad coached Little League baseball together when my brother and his son were playing ball, and really neat guy. So you mentioned Miss Kathy, and I would be remiss if I didn't ask about her. Um, what was that? You mentioned high school sweetheart.
Right.
Share with us a little bit, if you don't mind, just about that love story. Obviously, she's a beautiful, stunning woman with bright eyes like your daughters and all. But like, tell us, how'd y'all meet, and when did you know she was the one?
So back when I was in high school, I was at a club called the Interact Club,
Oh
and so
yeah.
we were actually having a what they call regional meeting, and she attended Southwood Academy, and I was at Ponchatoula, and Kathy was actually the high school sweetheart for Southwood Academy during her freshman year when I was a senior, and she was at the meeting there, and her friends had left her, and she had no ride home. And so I struck up a conversation with this beautiful young lady with blonde hair and big blue eyes. And I said, are you doing okay? And introduced myself, who I was and all that. She had no clue who I was. And she said, well, all my friends have left me. I have no ride home. And so amazingly, she agreed to get in my pickup truck and allow me to drive her home. And so I took her home to her house in Hammond,
Uh-huh.
met her mom and dad. And later on, I said, hey, can I have your phone number? It'd be okay if I call you or not? And she said, sure. And so she gave me her phone number. We kind of struck up a conversation there. And I started dating her at that point. And so I called her up. I said, hey, do you want to go to my junior senior prom? I don't have a date. And she said, well, sure. I said, but we probably need to go on one date at least before we go to prom together. And so we started dating from that point on.
Well, speaking of similarities, I talked about how our moms were like, but there's some similarities in your love story and mine. One thing we share in common is that we married these beautiful women. We've outkicked our coverage, so to speak. We married these wonderful women. But Interact Club, for those that are unfamiliar, is the high school service organization sponsored by Rotary International.
Right.
And the Rotary Club of Ponchatoula, by the way, Rotary has a fundraiser coming up for Interact where they're selling jambalaya that we Rotarians will be cooking for them. But as that aside, I met my wife through the Rotary Club at the Strawberry Festival. And like you, I kind of asked her on two dates before one. So it's a weird, but wow, that's God working in our lives, Doctor. Only He can do that. But thank you for sharing that. I know our viewers love a good love story. And to prove that, Rose Dominguez. Hey, Miss Rose, how are you?
Rose, love Rose.
She comes on and says, "Great story about Kathy. Not only a great doctor, you're a great friend too, and a great community supporter." Rose, you know what they say? It takes one to know one, right? Nobody does more community work than you. But I agree. Rose, I know is a big fan of yours. Did y'all come up together? Are y'all similar in age? How do you know the Dominguezes and Miss Rose?
Oh yeah, I know Rose Quave Dominguez, obviously.
Yeah.
From back in the high school days, we graduated from high school together.
Oh, very cool.
I've known
Very
Rose
cool.
most all my life, and I stay in close communication with Rose. When I have something I'm worried about with the school board, I call Rose up, even though she doesn't represent me anymore.
She's been great. I know term limits are some people like them, some don't. Whether you like them or not, certainly we're going to miss you, Miss Rose. Because I think without term limits, you could have been there forever if you wanted to.
Oh,
So I guess
geez.
that puts you, were you either in the same class or near as Mark Griggs? Were y'all around the same time?
Mark Griggs and I were in the same class. What a
Yeah.
wonderful
So
man.
Mark was like a big brother to me, a mentor, and we all miss him a ton. But yeah, neat class. So I guess that means you were there for integration, right? Is that around when that happened at Ponchatoula?
Yeah, absolutely. Yeah, integration occurred. Let's see, I came here sixth grade. So
Mhm.
integration started my seventh grade. So yeah, a little bit
Oh,
before
wow.
75 it did. Yeah.
Yeah, that had to be an interesting time to Mark told me a lot, many stories about it. Miss Rose says one more comment here that you've been a great friend for 50 plus years, and she does love her job. Thank you for sharing that, Rose. If anyone else here would like to talk to Dr. Allen, feel free to chime in. So,
Right.
Doctor, let's talk now about kind of the decision to come home like your dad did, because like your father before you, you've got options. When you come through LSU law school, excuse me, medical school, especially if you're, able to train at charity, as I understand it, to get an internship or residency at charity, that's nationally sought after because people, you're just so much action there.
Right.
You could probably go back out west, north, wherever, big bucks, bright lights, big city. When did you and Miss Kathy decide we're going to hunker down in our hometown, open up a clinic, and go to work with Dad? In your
Right.
instance, when did that decision happen, and how did it come about?
Well, I pretty much had already made up my mind. I want to do family medicine, being that my dad was a family doc and I had great respect for what he was doing. And I love that part of medicine where you took care from the cradle to the grave. You had all aspects. There was never anything
Right.
boring in family medicine. So, I mean, Kathy being from Hammond, me being from Ponchatoula, obviously we wanted to drift closer to our parents. And of course, my dad being an independent practice. I don't know if people don't realize my dad had a lot of health issues as a young man growing up. He had his first heart attack when he was 36. He had valve replacement. He had bypass surgeries. And when I was in residency training, actually when I was in medical school, he had actually residency training. He had his first stroke during my internship at Roque Long in family medicine. So I actually left my residency training to come back to Ponchatoula to open a clinic to maintain his practice until he was able to recuperate from his stroke. And so, thankfully, the people at my residency director was allowed me to do that. They had talked to me about maybe not being able to come back and complete my residency because I was leaving that period of time. So I came in 6 weeks, opened the clinic, and saw patients for him to maintain that practice. So he recouped and came back to practice. But my biggest
Mhm.
thing is I wanted to come back to help my dad. I wanted to come back because I knew having all his health issues, if he continued to work the amount of hours he was working, the amount of time and effort, because he was on call 7 days a week, 365 days a year, worked so many hours, I said he was going to die a young man. And so I came back just so I could just slow him down, allow him to have some quality of life. Plus, to be able, how many people get the opportunity to work with your father?
I know, what a
That's
blessing. I mean,
amazing.
one to elongate his career and life the way you did,
Yeah,
like you mentioned, but to get to be next to your dad, who is
right,
your hero the whole time, and
right.
to learn from a doctor of that magnitude as you're a young doctor, kind of on the upswing. So many layers of blessing there. That's really neat. So
Yeah,
what's that like? I would imagine, getting a feel for it. There's got to be some complications there, right? I mean, even though you and your father love each other, and he's grateful that you're stepping up like you are, but still, you're young, you're smart, presumably ambitious. What was that like as y'all kind of found your footing as colleagues?
well, I mean, Dad's attitude is okay. You're coming into the practice. I'll tell you what. He backed off a little bit. He allowed me to continue to build my practice, and basically give me some insight on how to build my medical practice. So when I came back, I started doing ER work on the weekends, trying to just build a clientele, if you will. But at no point ever became, a competition for me and my dad. It was always like trying to help one another get through the whole thing. And what's nice
Yeah.
about working with your father was that if I had a difficult case or something I was working on, I could walk across the hallways and present the case to him and say, "Dad, what do you think?"
That's
So,
cool.
so it was good. It was fun. We enjoyed it. But you know,
So I'm getting kind of a teammate vibe. Let's take that and transition into your career, each of your careers as the Ponchatoula High School team physician. So you do football and sports medicine, with them forever. How did that come to be?
that's an interesting question. So back in the day, A.J. Bacher, as you all know, was the principal at Ponchatoula High School. At the time, my dad had been a team physician from 1968 going forward when I came back here in '88. My dad had a little confrontation with Mr. Bacher. They didn't agree on the head coaching position at Ponchatoula High School. And so my dad said, okay, fine. So my dad stepped away as a team physician and Dr. Tillieu took it over for 1 year. And so I was in the office one day, and then walks Virgil, my Uncle Virgil, and walks him and A.J. Bacher. They immediately walk down the hallway. They go to my dad's office. They close the door. I said, I wonder what's going on. I knew there was some confrontation between my dad and A.J. Bacher about the head coach. I go, this doesn't look good. I get a little suspicious. So they're in there for like
were you at the door like this trying to hear?
No, but I was wondering what was going on. So after about 30 minutes, they walk out. Mr. Bacher walks directly over to me. As you know, he was my principal in high school. He shakes my hand. Congratulations, you're the new team physician at Ponchatoula High School. That's how it happened. I said, oh my God, really? And so I took over it primarily from then on, but my dad continued to be on the sidelines with me up until he passed away. So yeah.
Well, I remember in the 90s when we came through, my brother Bree was a great all-district player. I did not have his athleticism, so I'm the nerd on the sideline taking stats. That was my contribution. But I remember the two of you and your father roaming the sidelines, and I assumed it was just kind of some, code deal. But it was so neat that y'all got to do that. And I know I was really grateful. No idea at that time what a doctor's time value must be worth, but really grateful to see you guys would travel with them no matter where the team went. And clearly you just had a long-standing love for that. And that's really neat. Your Uncle Virgil was actually the tailback on the PHS team when my dad was the quarterback. So they were a year apart in age, my dad a year older, but they played in the same backfield, and Dad's always talked fondly of those days. Yeah. So that's neat. We have another comment coming in here. Sarah Anderson Bowers. Hey, Sarah. So good to see an old friend like you. She says, yay, Dr. Allen, and hey, Dr. Allen.
Hi. Hello.
So y'all keep them coming, folks, if you got something to say for Dr. Allen here. So, Doctor, as we talk about your career, one thing I've noticed in recent years is that, you don't just serve our community, but as I alluded to in the opening, you serve the world. You have taken, and you mentioned Wednesday nights for church and the role your mom played in getting you there on Wednesday nights. My wife does that for our family. She teaches the little girls at First Baptist Church on Wednesday nights, and she brings my boys up there to participate in the boys program. And when the boys have their RA camp out, you were kind enough a year or a few years ago to come out and talk to our group about your ministry and your trips, your mission trips to bring healthcare to people that could not otherwise afford it. And I was really blown away by that. And then I noticed this year, you brought people down there, some medical professionals like you, some not. If you don't mind, speak to that and the work you've done kind of outside the United States to help people that don't have the benefit of a Dr. Allen in their backyard.
Sure. So the way I really got started in medical missions was a guy by the name of Gary Dennis. As people know, Gary's a pastor.
Right.
And so, growing up, my dad always wanted to do missions, but never had time because he was so busy being, in solo practice. So I kind of got some experience from hearing him talk about it. But anyway, Gary Dennis approached me and said, hey, Greg, how would you like to go down to Mexico and do a medical mission? I said, well, Gary, I've never done anything like that. What's it all about? He says, we go down and stay in McAllen, Texas. We go across the border. We smuggle drugs across the border into Mexico. So wait a minute, smuggle drugs across the border to Mexico? What are you talking about? It was not controlled substances. It's just, medications for whatever, blood pressure, whatever. I said, okay, great. And so Gary Dennis wanted to got me involved in that. We were going down to Reynosa, Mexico, into the they call it basically the colonias, but they're just dump sites, seeing children. So I started there, going into Mexico. We did that for about 3 years, and then you got a little hairy. We weren't able to do it anymore because of the cartel issues. But we would treat over 100 patients a day in these garbage dump sites, taking care of children, parents, grandparents, treating diabetes, high blood pressure, heart disease, worm infestations, respiratory things, stuff like that. Then all of a sudden it stopped. And really, I said, golly, I was so missing Gary. Said, Greg, it's really not safe to get out anymore. So, well, let me know if you ever hear.
Is that when you say just stop? Is that because of the cartel dangers and the
cartel,
the border? Okay.
Yeah, the dangerous cartels. So one day I was going into church and I'm walking in the side door, and Robert Parkin's standing there with a big smile on his face. And Tony, one of our members of our church, he was from Honduras, was there as well. And I was getting ready to go through the door. It says, "Hey, Doc, what you doing?" I said, "Well, I'm getting ready to go to church. What's up?" He goes, "How would you like to do a mission trip in Honduras?" And it's really ironic he would say that because I've always had a love for missions. And not in that period of time when we didn't go down to Reynosa with Gary, there seemed to be an empty part of my heart that I was missing out on. And I've been praying that God would open up another mission for me to go to. And so there we started to go down to Honduras, to Marcala, that area. And we did, I think this is our third year to go. We'll be continuing to do this every year. So going down there, I said, well, how many doctors are we going to have? One. Oh my goodness. How many patients are we? We have no clue.
Wow.
I was able to recruit a couple of my staff people that work with Cheyenne and Cheyenne Landry, and who you might well know.
Well, she actually chimed in here. I was waiting to put this up in a bit, but Cheyenne says best doc in town, and we love him. So hey, Cheyenne.
I love Cheyenne. So I took Cheyenne and Charmaine down there. We opened up a clinic and we saw patients. We averaged probably 75 to 100 patients a day. What I love about it is that
that's just got to be backbreaking. 100 patients a day in the heat, away from home. You're not sleeping on a king size bed at night, and that's tough. Wow, that really speaks to.
Well, it wasn't that bad. I mean, you kind of get in a routine, if you will. You're sitting there, got an interpreter, you're seeing one patient after the other, and let me tell you, you never feel more loved and more appreciated than when you're seeing people in their need at that point in time.
I bet. I was having lunch with my best friend this week, Will Richardson, and he's very close with Dr. Rick Henry, the dentist.
Yeah.
And they do these, dental missions similar to what you've described. Yeah. But, it's all hands on deck. And Will, who's a bookkeeper and graduated from Tulane in business, not medicine and not dentistry, he talks about how when they go down there, he's pulling teeth too.
Like, absolutely. You recruit what you can get,
Yeah.
But this year I had Byron Willie, had Gloria Willie. And that was
I saw
fun.
That. And if you don't mind, one thing I saw that to me was the clearest sign you could have that it was a God thing was this bus that y'all saw when you were down. So could you tell me what kind of bus did you see all the way in Honduras?
So we're in Marcala, Honduras, which is near El Salvador. We're riding around, going to different locations to see patients. We drive by, and lo and behold, parked on the side of the road at a shop is a Tangipahoa Parish bus.
Tangipahoa Parish school system bus. And we have the mission crew from Tangipahoa Parish with the nephew of the former Tangipahoa Parish school system superintendent.
Right.
I mean, whoa.
That was hilarious. This got to be a God thing. Tangipahoa Parish came with us to Marcala.
Yeah, that is so cool. But what a neat story. I want to share here another, to me, quite impactful comment here because of who it's coming from. Miss Patsy Kraft says that you were such a fine fella. That's got to make me smile. She's just the best.
What a miracle lady. What an absolute miracle lady she still was. God.
Amen to that. She and my father were classmates in school and they're dear friends. And there's few people in this world I admire as you, Miss Patsy. So thank you for watching and chiming in. And another great lady follows her up with a much longer comment. but Laurie Agnew Hess, who was my childhood babysitter, Laurie says she remembers when Dr. Greg was just a summer crabber. How about that? When you started your practice with your dad, she was your first patient, and you, Dr. Greg, put a cast on her in the office. She had fallen in the boat and fractured her arm, and you were fussing about the medical supplies available for him to use. And Dr. Merlin laughed and said something to the effect of, "You aren't in the city anymore, son." And so she returned to the Poche camp with the ugliest cast, but it got the job done. 60 years of Dr. Allen's and Dr. And so I think, let me see here. And it says Dr. Greg was my daughter's, and we end there. Laurie, I love that story. I mean, talking about the Poche camps brings me back of our days on South Pass with Rat Poche and all his cab operation and his sons.
Dago Craft, the whole bunch.
Yeah. That's really neat. And that's the kind of stuff, like, you aren't in the city anymore just sums it up. You don't see that at Charity Hospital. Well, Doc, I promised I would be efficient with your time here, and I fear that we've gone a few minutes over. But before we close down, I just want to ask you, is there anything we haven't covered? Any story you want to share, or anything on your heart, on your mind, just anything at all that our viewers and listeners ought to hear from you before we go?
Well, I mean, what a blessing to grow up in Ponchatoula. But not only that, to have grandparents who love you so much. People don't realize that I used to be a commercial crab fisherman. My grandmother lived in Manchac. They're all from that area, in Acres, Manchac. And as a child growing up, my dad figured we need to learn our work ethic. So he shipped us all the way down to Manchac, the three boys. And we would crab for my grandmother throughout our lives. But for a lady who instilled a work ethic on us, Mary Rose Allen instilled an incredible work ethic for us. So I was truly blessed to have great grandparents and who took good care of us. My mother's mother was phenomenal, and so I was just so blessed to grow up in that type of atmosphere.
Well, I echo that. My two grandmothers, grandmother Layrisson and grandmother LeBlanc, helped raise us. And what do they say? It takes a village. When you're blessed with great, fantastic grandmothers, it makes such a difference. And yours is kind of a local legend. Everybody knew about the Allen Manchac operation. So that's really neat. Well, Doctor, thank you for sharing your time and all these wonderful stories with us. I really appreciate it. To our listeners, to our viewers that stuck with us to the end, thank you all. We'll be back here next week, same time, same place. And until then, y'all stay safe and stay healthy.